those, what I want you guys to pass around so you can feel that there's a hard side and a soft side to those. These ones have soft sides on both for the most part. That one's missing padding, so it's just hard. Sorry. If you don't have these splints, what else could you use?
A stick.
A nice, strong stick, right? What else?
Jungle bugs.
What? No, sweetie. No, but what about like things you find around the house? Do you have the energy to pull a fence post down?
I'm saying, assuming that they were stuck on the fence or something, and you cut it down.
You totally could cut it.
No, I could see how that could work. We're looking for something straight and non-flexible.
Broomstick.
Right?
Ski pole.
Broomstick. That's why we've got
Ski
broomsticks
poles.
here, right? We do have ski poles here for woofer, and that happens all the time. People just use their ski poles as a splint. I do appreciate your jungle clients.
I thought you were talking about the cravats.
I'm not Indiana Jones, but I'll keep that in mind for the next time I'm stranded in the jungle.
And break your leg.
Yeah, exactly. So this is for our joint immobilization, right? So what are we gonna do on our skill?
PMS, before and after.
Before and after. What else?
Manual stabilization.
Manual stabilization, because none of you guys are gonna fail this skill, right?
Yay.
Very simple skill. That's the way that it gets failed most often. The other thing that people do is they'll do like, hey, I'm checking PMS. He has a pulse. Okay. Did you just check PMS?
No.
You check
Just
pulse.
pulse. It's not PM or S. It's PMS. Pulse motor and sensory. So if we've got an injury here, PPE, BSI, my scene is safe. I'm going to manually stabilize the extremity. And really, when you're doing your manual stabilization, a lot of it is going to play into how you transport them and what's most comfortable for your patient, right? So let's say this is what's most comfortable for our patient, just slightly more extended than that. They have some sort of knee injury, right? Dislocated patella. I've done this with broomsticks on people before. I'm gonna have my partner hold manual stabilization, and I'll have my patient hold those sticks just like that. Now, I'm gonna have you hold them right here for me. Again, what is gonna impress me if you come into your assessment with this skill?
Patient affect.
Patient affect, right? Talking to your patient. There's so many different ways that I can fix this to his leg. I'm going to show you 4 different ones, so if you can't see, make sure you can come see how I'm tying these knots. And don't get stressed out about a specific one. Just practice and you'll find your own flow. So we need to tie above, below, and down low. Above, below, and down low. If you want to be extra secure, you can have another second one up above, but you need at least above, below, and down low. Yep? Yep. Cool. So where is his pain going to be in this injury? In his knee. In his knee, right? So we want to be really gentle with the area around his knee. You're going to be doing a lot of feeding here. You're not going to be pushing a lot of material through. You'll start with your finger and then feed it through. That's a great place to start your tie on this one. And then we'll wiggle it up to his leg right there. So now this one's going to be my above, right? Do your above first. This, you don't really have to measure your splint necessarily because it's a knee. So we're gonna come here. I'm gonna wrap around just like this. And tie. Doesn't need to be very tight, it just needs to stabilize. The entire purpose of splinting is to remind your patient that they shouldn't be moving what's splinted. It doesn't necessarily completely immobilize your patient. Itchy. You see what I'm doing with my knee here? And then my fingers on this side. I'm pushing the splint and securing it. I'm gonna come here, this point. then I can assess PMS again. Another thing you can do before that is if you don't feel like that's stable enough, you can come up, over, and do another stabilization. But that's gonna be too short. I would use longer material. So I tied those knots 4 different ways, and all of them are gonna work. The reason I tie my knots in specific ways, like these first 3 that I did, is can you feel how that's circumferential around your whole leg? Like, it's there on the poles, but it's also physically on his leg, which will provide better reminder not to move your leg. The last way that I would stabilize this is make sure that his leg gets placed on a flat surface, whether that be a spine board or the gurney. I'm making sure that he can't bend his leg like this, but this will remind him not to extend his leg like that. Huh? Yeah, but you know how it's not meant to completely immobilize. You guys will get really frustrated because it's not completely immobilizing it. That's not what splints are for, right? You don't want to trap your patient's extremity. I've seen people literally like crank down on the broom handles to the point where they bow and touch, and like the person's leg looks like twice the size or half the size it usually is. So just remember that you're going for patient comfort and patient affect and PMS afterwards as well. Okay? Very cool. You can do the same thing with an elbow with those. I would just sling and swath. It's easier, it's more effective, it's less annoying for your patient. Thanks, Logan. Give both of our volunteers a round of applause.
It's outside in, right?
Yeah.
Obviously.